1 in 3 American adults says that they've used fertility treatments in order to grow their families or known someone who has. For many couples, those medical costs are covered at least in part by their health insurance or by employers. But LGBTQ people are frequently left out. And now 2 couples in New York are leading a fight for what they call fertility equality. Our Devin Dwyer has the story in tonight's Prime Focus.
We've always wanted to have kids. We knew when we got married that we wanted to have a family. We grew up with siblings and families, and we wanted that. I think it's such an innate human thing.
For Emma Goydell and Alana Kaplan, building a family in New York City was never going to be easy, but they never imagined the cost.
We looked really closely at our insurance, and we saw, oh my God, Aetna covers fertility procedures. But then when we read the fine print, we saw, wait a minute, this coverage is only for people having heterosexual sex.
While some insurers cover treatments like IUI or IVF for straight couples who struggle to get pregnant, they often won't cover those same services for lesbian or gay couples until they've paid out of pocket for up to a year.
We thought, that's crazy. That's so unfair. How is it okay to say, if you're straight and your partner can't get you pregnant, you come into the doctor and we'll cover your treatment. But if you're queer and your partner can't get you pregnant, too bad, you're gonna pay.
Emma and Alana spent nearly $50,000 of savings to have their now 1-year-old son, Avi.
What did the insurance company say when you asked for coverage?
Because we hadn't done 12 months of IUI treatment at the doctor in order to qualify. They said, as a same-sex couple using donor sperm, you have to try to get pregnant for 12 months with a doctor before we'll pay for anything.
We had to turn to IVF, which sounds crazy because IVF is so abhorrently expensive. But we felt like, how much longer can we pay out of pocket for IUI if we're not seeing it work?
My partner can't get me pregnant, whether that's because she doesn't have the gametes or something's going on internally with me. No one makes that distinction when you're a straight couple. They just say, come on in and we'll pay for it.
Goydell filed a federal class action lawsuit against Aetna in 2021, accusing the insurance company of sex discrimination for denying equal access to fertility treatment. The company, in court documents, denies the claims, saying Goydell did not meet requirements of the health plan. Aetna telling ABC News it's committed to equal access and offers infertility coverage for our plan's sponsors, adding it supports the LGBTQ community and will continually evolve benefit coverage.
Americans overall lack access to fertility health care, right? Only 14 states provide coverage for IVF, which is a really important, very effective treatment for fertility.
Polly Crozier is an attorney and advocate for LGBTQ families.
When there's not access to fertility health care in your state, it particularly hits LGBTQ people hard. And then, even in the states that do have access to fertility health care, LGBTQ people, there are different standards. There are different rules for those families. It's just not equal.
For gay men who want their own kids through surrogacy, it can be even more complicated.
The sticker price was really staggering.
Corey Briskin and Nick Majapinto say neither their health insurance nor Corey's employer, the City of New York, would cover any costs of fertility treatment needed to get a surrogate pregnant.
They're reinforcing the idea that gay men are not fit to be parents, but single women, heterosexual couples, those people are fit to be parents. There's just no way that that's not some form of discrimination.
If you were a heterosexual couple and needed to do IVF, what would they cover?
They would cover the entire IVF process.
All the total cost?
Total cost of IVF.
Yeah.
The hurdle, the number one hurdle that everyone that we know faces, every same-sex couple faces, is that they can never meet the definition of infertility, which is the threshold, qualifier for covered IVF.
They filed a class action discrimination complaint with the Equal Employment Opportunity Commission, seeking a nationwide order that employers must extend fertility benefits to LGBTQ employees. The city, which declined an interview, argues the charge should be dismissed, telling the EEOC practically all employer-provided health insurance does not cover IVF for surrogates, a position they say that is consistent with the law and is not discriminatory.
I think there's a fair argument that that's sex discrimination, sexual orientation discrimination, and frankly, just bad business.
A small but growing number of companies are providing benefits for family building outside of insurance plans, some chipping in for IVF, others offering to help cover the cost of adoption.
why not pursue adoption?
There's nothing wrong with adoption. And for many people, that is a really wonderful option and maybe even their preference. And that's great. Nobody should be telling those people that they should not adopt if that's what they want to do. But at the same token, no one should tell us that we should build our family that way.
A lot of queer couples, unfortunately, have to make really tough decisions. And often what that means is not having a family.
As the legal cases play out, both families are optimistic change is on the horizon.
We are hopeful that whatever becomes of this, there will be a change for the better for people who are similarly situated to us.
Our thanks to Devin for that.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.